everyone. Welcome to Feels Out Loud, brought to you by Becoming Together Therapy and Wellness. This is your host, Tara Martini, along with Becky McNattin. We are glad to have you listening as we live and share stories of mental health.
Tara, we have a super important show today. Now, sometimes we say we're really excited for the show. I'm looking forward to the topic, but this is a really important show.
It is.
We are talking through premenstrual dysphoric disorder and going to deep dive into this diagnosis. Sometimes it's also called PMDD. And according to the National Institute of Health, get this, 5 to 8% of women have moderate to severe premenstrual symptoms that cause significant challenges to functioning and fit criteria for the diagnosis of PMDD. Wow. 5 to 8%. Part of what I am so fascinated about is how little discussion and education is available around PMDD. And I think about, even as a therapist myself, I don't remember ever talking about this issue more than in a review of various diagnoses in a clinical diagnosis class years ago.
I never learned anything about it.
Totally believe that. And with 5 to 8% experiencing PMDD, this seems like a huge gap in mental health care. Molly Jockheck is here today, joining us on the show. And it's amazing. Welcome, Molly.
Hello. I'm so excited to be here.
You are a local therapist who has a practice that includes a whole spectrum of diagnoses and treatment strategies, but you're here to talk with Tara and I today about premenstrual dysphoric disorder. PMDD is what we'll probably call it a lot because that's a lot of words. And we have so many questions for you, so I'm grateful in advance for your wisdom around the mental health impact of PMDD. But first, as we get started, tell us about you.
Hi. Yeah. So I'm a licensed professional clinical counselor here in Minnesota, and I've been practicing since 2018. And
Okay.
I've had a variety experiencing ranging from specializations in 0 to 5 in CBT, play therapy, and then now I focus more on trauma and bereavement work using accelerated resolution therapy. But I'm also master trained in perinatal mental health, as well as having an emphasis on cultural and religious components in care.
Wow.
Whoa.
So you are trained in a variety of ages, demographics. Wow.
Yeah.
That's
wanted
incredible.
To get a range.
Yeah,
That is.
So tell us a little bit more about what makes you passionate about PMDD and treating this issue in your mental health practice.
Absolutely. So when I began practicing, I told myself that I wanted to bridge the gap for demographics that I have been a part of, including being a biological female demographic and as well as a BIPOC female. So in this case, biological female is important with premenstrual disorders because you need a menstruation cycle to have those. But my passion specifically derives from many things, but ultimately wanting this disorder to have a platform so the people who suffer from it can be seen and heard.
It's astonishing to me, and we were talking before we went on air, the idea that as a female, to never have learned anything about this in association to when even just learning about our menstrual cycle, how this was never brought up in correlation to premenstrual cramps or symptoms. And that's astonishing to me that it's just was completely left out and omitted.
And so why do you think, would love for you to weigh in on this, Molly, why do you think we aren't discussing the circumstance at a rate that highlights the prevalence of it, where it would be match a little bit more?
Sure, absolutely. My personal observation in clinical work is that we as a field are just too uninformed and don't have the right tools to assess a disorder that is just as much medical as it is as it relates back to mental health.
That makes sense.
As I've been in practice, I've noticed the profound gap in the way that women are assessed in mental health. Symptoms can often relate back to the menstruation cycle. And a while back, I began to notice how disorders such as PMDD and another one as common as PME are overlooked and underdiagnosed in mental health.
Yeah. So we're going to dive into all of this.
Yes,
it's so much to explore. We won't get to all of it in 1 hour, but we're going to get to a lot. Such an important topic. We're going to take a short commercial break, but stay tuned as we further explore PMDD, along with symptoms and the treatment for this. Thank you for listening to Feels Out Loud, everyone. We will be back in just a moment.
You gotta find the people.
Welcome back to Feels Out Loud, brought to you by Becoming Together Therapy and Wellness. I'm Tara Martini with the fabulous Becky McNattin. Let's dive right back into our discussion on premenstrual dysphoric disorder.
So many things to talk about today.
So many things.
I feel like it's lots of letters, lots of words, lots of symptoms, and all things that lots of us don't know about. So
Sadly.
yes. So we're all here to learn together, everybody. If, as you're listening, we're exploring it together. Molly, what would you say is PMDD? How would you explain it to us?
Sure. So at its heart, PMDD is the brain's negative sensitivity to the rise and fall of progesterone and estrogen during the ovulation cycle that causes impairing mood and physical changes in the body.
Okay.
IMPMD.org defines it as a cyclical hormone-based mood disorder. So anything between days 14 to 28 of your cycle, you can be experiencing symptoms.
Okay. So it really is referencing that what could be extreme mood and physical experiences during what would be someone's monthly cycle.
Okay. And what are some of those symptoms?
Some of those symptoms, I love that question. So they can kind of get broken up into different categories of emotional, physical, interpersonal, cognitive symptoms. Some of the emotional symptoms, extreme mood swings, tearfulness, rage, a lot of suicidal ideation can occur during that time. As far as interpersonal conflict or interpersonal relationships goes, you can have more anxiety in your relationships. You can have a little bit more perceived interpersonal conflict that can arise. Physical symptoms, you can have hair and skin changes if you're noticing hair thinning, if you're noticing acne and breakouts, extreme food cravings that are feeling uncontrollable, breast tenderness, bloating more beyond than just like PMS. Everything is kind of like extra amplified with PMDD versus regular PMS symptoms. And
that's a good question because in my clinical practice, I've been asked, this would be more recently in the last couple of years because word has started to get out a little bit more about PMDD. I've been asked about the difference between PMDD and PMS. And how would you clarify that for folks?
Ooh, I like this question. So timing and level of dysfunction is everything when assessing PMDD versus PMS.
Okay.
So what I usually do is I have clients track everything, like mood, physical sensations, the bloating, hair, skin changes, motivation, sociability, conflict, thoughts of harm. Normal PMS isn't supposed to be causing dysfunction, let alone suicidal ideation. And so that is some of your biggest tells between the difference of PMDD and PMS. And PMS is during the time of menses itself, and PMDD is always going to be from ovulation up to menses.
Okay.
So timing is key.
And being aware of, we've talked about on other shows, just being aware of our body that we don't do a great job of as a society.
No.
And learning how to tune into what those messages are. I love hearing that you ask people, note everything. Be very aware and tune in even more so because days move into the next week.
Absolutely.
And we can forget day to day, but I hear you saying to really note this intensity part and how frequent and maybe how much in duration these symptoms are present too, but how significant are they?
They're really pretty significant. So during the time of ovulation, what can happen is a lot of impairment in occupational functioning can occur. Maybe you're not showing up to work. Maybe the depression is really high and you are just kind of stuck in your own thought loops. Physical inflammation can occur. Maybe your chronic pain is higher. I think earlier I noted breast tenderness can be a lot higher, so just feeling really uncomfortable in your body. And then with the depression side of things, that's a huge key, and rage is very common in PMDD, and so that can be really dysfunctional when you're trying to parent, when you're trying to go to work, and you're just not able to get outside of your own thoughts, and for like 2 weeks at a time.
Yeah. And then I would imagine some experiences of shame around responses that you might have. If rage is a part of it, then feeling guilt about whatever happened.
Absolutely.
Wow. So could you tell us about kind of the nuances of PMDD versus postpartum issues,
Sure.
because I think that's also, there's, correlations and things like that.
Absolutely. So with PMDD, you need ovulation to occur, and postpartum depression is different than even baby blues. So when someone is newly, a new mom, the first 2 weeks, baby blues are common. You've got a lot of hormone situations going on. You've got a lot of fluctuations. And then postpartum depression tends to set in after that 2-week period and can go, can be elongated for as long as it's not treated. PMDD needs ovulation to occur. So if you're not ovulating, it's not
point.
likely going to be PMDD symptoms. And also when you're a new mom, some of those symptoms are unreliable, like breast
Right.
tenderness, fatigue,
Yes. All the
headache.
things.
Some of the things might start to
Sure.
overlap. So again, timing and what your body naturally is doing with its cycle. But with that, if you have PMDD, your likelihood of postpartum depression or other perinatal disorders is going to be higher.
That's what I was
Okay.
just going to
Yep.
ask. I was just
Yep.
going to ask that. And people may go into a postpartum experience without knowing they had PMDD. We're talking
Right.
about people who we haven't had this discussion much as a society. So
Yes.
they might be finding out about PMDD from their postpartum experience.
Exactly.
Which is so difficult, because how lovely would it be to know, like, going into it, just that awareness of, like, okay, likelihood is increased. But if they don't know that they have it, and then the
Right.
unknowing of, or not knowing, then they're struggling with postpartum.
Yeah.
Absolutely.
Yeah. And go ahead, Matt.
Oh, I was going to say sometimes PMDD can develop at any point in time in your life. So you might be able to develop it in adolescence and not necessarily know it. People can develop it perimenopausal
Okay.
before they kind of go through menopause. And then subsequent pregnancies can increase your likelihood too. So it is a disorder that can develop over the lifespan too. So it's not like you have it or you don't.
That's so interesting. It's not that if you're 30 or 40 and haven't had experiences of this yet, that you're like out of the opportunity.
Yeah. Well, then I have to ask, maybe, so the onset can come at any time.
Absolutely.
Then then is it just you have it the rest of your life?
Good question. So when females go through menopause, right, and the ovulation cycle essentially
Well, right.
stops,
Yes.
right, then
right. You have it until then. Yes.
you have it
yes.
until then. So that's kind of like the hallmark
Right.
of when it can cease for
Okay.
people, depending on what treatments you have that are treating it up until
Okay.
then too.
But you would have it till then.
You would have it until then.
Wow. So an adolescent, wow.
And we'll talk
That's a
about
long-
treatment
Yep.
options in a little bit. But you highlighted, I want to go back to something quickly. You talk about symptoms that might be somatic. That's what we call physical symptoms, certainly psychological symptoms. So I think about that as, and then you said something about relationships. And I think about that as kind of an internal experience and an external experience. How can PMDD show up as an internal experience and an external experience?
Sure. So internal experiences can be, I'm stuck in my thought loops.
Yep.
I have all this rage pent up, but I might not externally be expressing that. Or the physical sensations. People might not know your chest is tender. With people with PMDD, it's a lot of being stuck in the thought. And what makes it dysfunctional is that if that's seeping out and people are starting to see it, which is like that external experience. I kind of give the example of the interpersonal conflict of, let's say you have PMDD and you have a roommate who keeps leaving the dang mustard out on the counter. When someone is not ovulating and struggling with their PMDD week, they might look at that mustard and say, that's kind of annoying. I wish the roommate would put that away. They either can put it away for them and or say, hey, roommate, put this mustard away. If they're in PMDD, they can have a range of different responses, varying in intensity. And the idea of it could be a little bit more of a verbal altercation of like, oh, you're so sloppy, put your stuff away, all the way to this isn't working out, move out.
So what extreme?
There's an
kind of
extreme response. And that can be that dysfunctional impairment piece where people are in their symptomology of PMDD versus when they're a little bit more out of it.
Well, and think of the impact that has then on relationships.
Absolutely.
Huge impact.
Yeah.
Huge impact on any relationship. Because this could be at work. It could be somebody who, if someone's listening and this has occurred for them in the last while, that someone gets something too late, or
Right.
they send an email that you didn't, that would be not, your reaction doesn't totally match what initiated this.
Right.
Yeah. And I do want to be very clear. Sometimes with PMDD, it's tricky of like, it's valid to be upset about the mustard, but the response isn't always going to be helpful or healthy to that.
That makes sense.
And so that's kind of where people who struggle with PMDD of like, is this valid? Is this irritability or is this rage? Where am I at? Do I have the right to be upset about this? And I would say not necessarily it's not about the mustard itself. It's about the intensity surrounding it.
Yeah.
Well, and I think you stated it perfectly in that it does not match, right? The response doesn't match the behavior.
Absolutely.
Or
And
the stimuli.
Yeah.
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 You mentioned PMDD week.
Yes.
And so I want to dive into that a little bit more. Do you have any thoughts about kind of tips for that PMDD week?
Yes. So I came up with an acronym of like giving yourself a prep talk, PREP.
Ooh.
We love those.
I know. I do too. So the first P is plan. So plan for your symptoms. Identify your low days and give yourself permission to rest, recover, reallocate workload, and reorganize what you need to. With the R in prep, real. And kind of remind yourself it's not real. Find a reminder that you and your loved ones can help you anchor in when those thoughts are coming for you, like the suicidal ideation, the thought loops, and saying like this will pass. This isn't real. The E in prep, be explicit in what you need. Communicate with your loved ones. Ask for mulligans. Ask for understanding. Sometimes the issue can wait, and work through it later. If you know that you have a higher risk of interpersonal conflict or higher intensity with conflict, try to use that mulligan. Try to say, we're going to come back to this because it's valid to be concerned about, it's valid to be irritated about, but I don't want my response to be invalid. And then the P.
I love that.
Yeah. And then to the P in for PrEP is predictability. PMDD is a cyclical disorder. So I'm guessing, and I would bet a pretty penny, that your symptoms as a PMDDer has a pattern. So find the pattern, and you can use that knowledge to your advantage to cope.
Wow.
I'm letting this sink in.
Me too. And I'm also thinking how that would apply to so many other diagnoses.
Oh, totally.
Absolutely.
Yes. In the recognition of, because of the predictability and the cyclicality, we can plan ahead a little bit. And I hear so many thoughts about, as I'm letting it sink in, I'm kind of just absorbing in this moment. And Tara and I tend to have these like brain
Mind blown.
spark. Yeah.
Yep.
And how helpful that would be to say ahead of time.
Absolutely.
Like, how can I create spaces to give myself some grace, knowing that this might be a challenging week? We could use this across the board with any diagnosis, but particularly something that we know is of cyclicality. And maybe PMDD week would be the time to not decide about a new job.
Yeah.
Or
don't make
to-
those big decisions.
Yeah.
Absolutely.
Don't bring up the hard conversation
Yes.
with the family members.
Yes, this isn't
partner.
a time to explore a new budget.
Yeah. Oh, yeah.
Right.
So think about, and
Yes.
and I'm being a little silly, but to think about those things ahead of time and be able to say, because I hear you in I don't want my response to not create a legitimacy for whatever content we need to discuss or whatever needs to happen.
Right, absolutely. Like PMDD is such a mental gymnastics, and kind of to your earlier question of PMDD week, usually it's actually kind of like 2 weeks if it starts anywhere between, day 14 and goes all the way to 28. And PMDD does not negate PMS symptoms. So with PMDDers, they're struggling for 2 weeks, and then on top of that, whatever PMS symptoms are coming your way. And so it's kind of like you really only have, a week to 10 to 12 days, depending on your timing of your cycle, to really recover and feel
Wow.
at baseline again before you're back in the thralls of it. And so it's like the prep and preparedness of it is really important to tease out some of that, so you can better equip yourself to cope.
So with this wonderful prep, Obviously, in order to use that, you need to know you have it.
Yes.
So how does diagnosis work?
Good point.
Ooh, good question. So again, kind of with that profound gap in just the way that women are assessed in mental health, or really in any kind of field of medicine, is I would kind of have these internal questions of saying, do I notice myself being rageful that feels outside of character? Am I noticing myself picking fights when that's not really what I want to be doing? Am I noticing physical sensations that are just really uncomfortable, that feel a little out of the norm of normal PMS?
Okay.
And then start talking to doctors, start asking, like, hey, I think I have things that are a little out of the norm of normal symptoms. And I've heard about this thing called PMDD and premenstrual disorders, and there's PME, and that's a whole different conversation. But asking therapists, your GYN, endocrinology, psychiatrist to say, I want to be able to be assessed for this. And that can be as simple as pulling out the DSM and going through the criteria of, like, do you experience this stuff? And if so, start encouraging clients to have conversations with their medical providers of treatment options.
And maybe they could even start, if you're already in therapy, listeners.
Absolutely.
You could
Yes.
talk with your clinician about this.
Yeah.
There might be a good chance that your clinician doesn't know a lot about PMDD because, as we've just said, well, there are 3 therapists in this room.
Yeah.
And until we made an intentional focus on learning about this, it wasn't readily available to us. So, but that could, if you are already in therapy, that's a great spot for questions and to ask and to think through what have they also noticed as they've been meeting with you, if this is a longer term relationship. Is this something that they've picked up on in terms of cyclicality or patterning as well?
Absolutely. And I think that's important too for anybody who might be diagnosed with other cyclical disorders like bipolar 1 or bipolar 2 or borderline personality or some of these other things that feel like, oh my gosh, these clients are using their skills, they're coping, they're doing all the things, but they're still in the thralls. That would be a good hint for providers to say something else might be going on here. And
Another layer.
another layer, and to just go back to the drawing board a little bit and say, let's just assess and or rule out or cross out the possibility of these. It can't hurt.
Yeah, and I would guess that in getting to treatments, that because this is a physical, a psychological, an emotional experience, relational experience, that it then requires a physical approach, a psychological approach. So someone may be getting some medical care for PMDD symptoms. They may also need therapeutic, like psychological care.
Oh, absolutely.
Via a therapist. What would you say to types of treatments, Molly?
Yeah, so with on the therapy realm of things, CBT, DBT, so cognitive behavioral therapy, dialectical behavioral therapy,
Okay.
Acceptance and commitment therapy, and that's important for some of those thought loops that can be really harmful. Exposure to the thought, so a little bit more on that exposure therapy side of things, but you don't necessarily need like the hard model for that. Anything that will help clients get ahead of these thoughts that they get stuck in during those PMDD symptoms, and narrative therapy of like, what is your experience with this? Tell me a little bit more about how this shows up for you of your sense of self. What does this do for you and your confidence? All of these things, and it's a lot of insightful reflection and getting a better understanding of like just how you present through the weeks of your menstruation cycle.
Sure. I think it makes me think about what even is the discussion you're having with yourself. When you're talking about a thought loop to our listeners, this might be a statement you're telling yourself over and over again that you're not necessarily even aware that you're telling yourself. That's part of what therapy can help tap into. Are you saying, gosh, you're so crazy? And then how would you receive or absorb that message that you might be telling yourself? And what kind of dialogue are you having internally? What's that conversation that's going on all the time?
Yeah, some of it is, every PMDD person, no 2 periods are alike, no PMDD is alike as well. And so sometimes
Makes so much sense.
With suicidal ideation, it can occur or it can show up as I'm not, I'm a burden to my family or my friends, or I have this self-belief that I just can't get ahead of, and or I believe I'm hurting out those around me.
Sure.
Right.
That kind of thing. And so just being tapped into these thoughts and or like the interpersonal conflict of, gosh, like they just don't do enough for me, and almost like kind of bargaining with the relationship. A little bit of like, is this serving me? Is this not? And if you're
Sure.
noticing that pattern, that might be a good hint too.
Wow. Well, so what kind of apprehensions or worries do you hear from people as they're starting therapy for PMDD?
Sure. The biggest one that I've seen in my clinical practice is it going to be this way forever? And I think, Tara, to your earlier point,
Yes.
like,
Yeah.
when is this going to be done? I'm like, kind of menopause, unless, and or
Which
you,
can be very disheartening to hear. Like, if you're a younger,
Talk about hopeless.
a younger
Yeah.
client, like a teenager,
yeah.
they're 18 and it's like, you're what? But you say there are treatment options.
Yes. Yep. And so what I say to that is that nothing changes if nothing changes. And so find your patterns, work with your providers. And this is kind of like an all hands on deck with treatment. So GYNs, therapists, especially psychiatrists, and everyone should be talking. There's a lot of coordination of care that is going to be better. So let's say someone is misdiagnosed with bipolar 2. There's not enough Lexapro on the planet that's going to change the hormonal imbalance and response. And so this is where like it is crucial to get the right diagnosis if PMDD or PME or other premenstrual disorders are present.
Yep.
Wow.
And I just think about one way to look at this is hopelessness. So I hear that, and there might be listeners saying, "Oh my gosh, we're talking 20 years. I'm 25 years old or something." But like with anything, I love how you say nothing changes if nothing changes.
Right.
That there also can be a very hopeful way to view this.
Absolutely.
That within the context of where you sit, wherever you are, there are things we can do. And our world now is beginning to talk about this. It is definitely sad that we haven't, and I'm sure us in this room have some bias around wishing that conversation was more, but we're even starting and continuing it today and having this conversation that there are treatments out there, and we're learning more and more and more all of the time.
Absolutely.
And so if as you hear from people, well, huge apprehension, like, will this ever end? No, and we can work with this. It isn't just going to continue we're not powerless to it.
Right.
And you're worthy of that support and,
100%.
to have that.
Would you say that there's barriers to either diagnosis or treatment of PMDD?
Oh, absolutely. So there's a statistic of there are 20 million women in India that suffer from PMDD, 4.2 million women in the U.S., and then 1.4 million women in Japan, meaning that Asian women are the largest demographic so far, according to the UK, and they're the leading researchers of PMDD. And so as far as barriers go, we know that people of color face barriers to mental health and medical care every day. But I think there's also provider knowledge as a barrier, or lack of, and lack of training.
Absolutely.
We just proved that today.
Absolutely. Lack of appropriate screeners across all disciplines, more than just the PHQ-9, which is a depression screener, GAD-7, anxiety screener. We need more thorough screeners to help assess for this, and there are some out there, but clinicians aren't trained or given those access or even know that they exist.
Yeah.
Lack of public knowledge about PMDD. How many women in your life would know what PMDD is? If you were to go to the people in your life and say,
Very few.
hey, friend, tell me about PMDD. My guess is that they would look at you like, what is that?
Right.
We can't seek out care about something that we can't conceptualize.
Right.
Oh, well said. And it has me thinking about how many people are probably living a misdiagnosis, that they are living with PMDD and have been diagnosed with something else.
Absolutely.
And are receiving medications based on that diagnosis that is inaccurate because nobody assessed for PMDD.
I also think, though, as far as if you just think of the role of women in general in our culture, the idea of saying, what I have is more severe than other people's,
Sure.
and I am worthy of going to the doctor to check that out and deserving of help. That's very rare for a woman to admit.
100%.
And so I think that's why there's so many, women out there who have not received or sought treatment, because how many in our audience and at this table sit back and just go, well, I just get really bad PMS, and just chalk it up to that, and would never, admit, hey, I'm going to go. It's always putting everybody else first.
Sure.
Well, and absolutely. And from my practice, too, is what I'm realizing is that women, we know about menses, we know about menstruation, but a lot of times we can't even name all of the stages of the menstruation cycle. And again, knowledge is power. And I think just as a general society, we are just so uninformed. And there's also hasn't been the research on it of like what this really can do to the body. And then even the intersects of PMDD and ADHD or even OCD.
Sure.
Estrogen and dopamine and serotonin. If estrogen falls, the rest of them do. And so symptoms of ADHD can increase. Symptoms of OCD during ovulation can worsen because your dopamine and your estrogen are crashing. So it's there's so many different intersects.
Yeah. And I had wanted to ask you today, how could we increase discussion about this? And I find myself, you said it so beautifully about 2 minutes ago, that one way we can do this, to me, there's a takeaway for me today, is to go to the people who I know who are women and ask them about PMDD.
Absolutely.
When we think about, well, how can we increase the discussion around PMDD? How can we work on some of those barriers about lack of knowledge or lack of even looking this up, lack of awareness that we can't seek help about something we don't even know exists?
Sure.
That if there are listeners who are tuning in right now and thinking about this, I would guess somebody without knowing it who has PMDD, and they may not know it either. And so part of the way they could take part in change is by just bringing the topic up.
Absolutely.
To like 3 people in their world. It's kind of a challenge we could do with every listener who's tuning into the show today.
That's a great idea.
Wonderful idea.
Just take on the discussion yourself and say, what do you know about PMDD? I just learned about it on this show. And have you ever heard about that? And now you have 3 more people who have discussed the topic.
Who are in the conversation.
Yeah.
Absolutely. Well, anytime society hears about menstruation, they can be grossed out.
Yeah.
They can be dismissed.
There's a stigma to it.
Absolutely. Or confused. And to Becky's point, we need people to be more willing to hold those conversations about women's health in general, let alone PMDD. For supportive people in our lives, maybe your wife did blow the mustard on the counter out of proportion, but why? Like start getting curious. And encourage your loved ones to explore their own reactions without shame. Start in your own homes to see if there are patterns and mood changes that don't make sense to the situation. Or if you have a loved one or a friend or any female in your life that is that seem to be struggling on maybe a little bit of a more rapid cyclical pattern, of just check in with them. Start a conversation, and not that we're trying to play pseudo-therapist or pseudo-diagnosis out in the wild, but saying like, hey, do you know about this?
Yeah.
Knowledge is power.
Tara and I talk on the show all the time about compassionate curiosity. That is
Just going to say that.
That is that embodied of
Yep.
being curious with the people who you know and care about on what might be the case for them. That to me is a authentic and true loved one. So my guess is you've seen treatment make a difference, and that this is a lot of what you do. If people wanted to learn more about PMDD, where could they go?
Sure, absolutely. So IamPMD.org is the best resource out there. They are a UK-based website, but again, the UK is the leading research in PMDD, and they have every resource that you could want. They have screeners. They have PMDD versus PME. They have research articles, so it's very evidence-based. They have advocacy tips. There's a doctor in functional medicine here in Minnetonka, Dr. Kupov, and they specialize in PMDD. So here
Wow.
there is resources here in our, own community. There are a lot of online forums that people can join as far as community, kind of like the support online forums to say, hey, this is what I'm experiencing during this week. What about you? And that can really help challenge some of the shame of like,
Yeah, they're not alone.
They're not alone. And it can
For
be
sure.
such an isolating experience.
And when you say screeners, are you talking about like assessments someone could just take themselves?
Yes.
Okay.
Yep, self-screeners. And even if like,
That's great.
yes, and it's something to go back to your providers and say, hey, I took this screener and I checked off a lot of the boxes that I didn't even realize I was gonna check off.
Yeah. What a great starting point for those people listening if they're thinking, hey, that might be me.
That might be me.
It'd be a good starting
Yeah.
point.
Absolutely.
And so, because I love to kind of note the hopefulness of it, would you mind sharing an experience where you've seen it? Treatment make a difference?
Yes. So since becoming informed with PMDD in my clinical practice, I've helped over 10 people be successfully diagnosed with
Wow.
PMDD and have taken this information back to their medical providers and have gotten on correct treatment regimens, whether that has been different levels of birth control or homeopathic pieces, maybe some hormone replacement therapy. Again, every PMDD is different. So what works for one individual might not be what's suggested or works for the next individual. And then along with like kind of using that prep and having them gain so much more insight and kind of some salt on the ice of like I've got some grip on.
I love that metaphor.
Yes.
I've got a little bit of grip on such a tumultuous week, or what can be a tumultuous week. And in other severe cases, ovectomies and hysterectomies can be recommended for folks who just aren't recovering fast enough, or they're not getting out of the loops before they're back in one. So there are a lot of different treatment regimens out there in varying capacities and varying intensities, depending on how severe your PMDD can be.
Yeah, I would think that there is so much power in even knowing what it is,
Yeah.
of knowing what's occurring for you, and that you have capacity to respond to that thing. It's enormously empowering to know, and then hope giving that there is an ability to respond in healthy ways.
Absolutely. So much.
And I think there is something so beautiful in the idea of it isn't just one blanket treatment where you are seen as an individual and they are focused on me and what is best for me and what's going to work for me. I think that is so powerful.
Yes, absolutely. And there is hope with that, right?
And greater buy-in.
Yeah, absolutely. And the people that I've worked with PMDD, I've had people have a lot of success with just getting on the right birth control regimen or just to kind of like help with that sensitivity to the fluctuation, all the way to people who have experienced or been recommended for surgery. And in either cases, these people are feeling all sorts of feels, but also like this hope of like, but there is an option. I don't have to be in this, like I have to be in this for 30 years, or I have to be in this until I hit menopause. And because menopause has fluctuations of estrogen, that means that's going to be extra hellish. And so there is hope.
Yeah. Well, before we go, tell us how people could find you.
Yeah.
If they want to know more from you.
Right. So the best is just to email me right now, molly.jockheck, JOCKHECK @outlook.com. I am an independent contractor through Emerald Therapy, but I am getting my own practice off the ground as well called Casa and Embers Therapy. It's not quite live yet, so I don't want to direct people to go to that quite yet. So my email is going to be the best way to get a hold of me.
Awesome.
That is so exciting.
This has been such a cool conversation. So much to think about here. And we're going to head to a commercial break, everyone. But when we come back, we're going to talk through all of our listener questions about PMDD. Feels Out Loud will process your thoughts in just a moment.
Well, then you'll find yourself. You gotta find the people. Express yourself.
We are back again with Feels Out Loud, and this is part of the show where we talk through questions from you all, our beautiful listeners. If you have a question related to mental wellness, sharing feelings, or our topics for each week that you would like us to process through, please visit our website at becomingtogethermn.com and find the Feels Out Loud page to submit a question directly. Or email us at contact@becomingtogethermn.com. Of course, follow us on social media as well. We really do want to hear from you and what you are wondering about.
And thank you, listeners,
Yes.
who you've sent in questions about PMDD. I chose a specific question today because you all know how much I love perspective. You've learned that in this show. And this question has a couple different perspectives to me. And the question was, how can I talk about PMDD with my loved ones? Do you have suggestions? And initially, Molly, when I heard this question, I was thinking that this was a person who wanted to talk to a loved one that may be noticing having some PMDD symptoms.
Sure.
And then I realized, oh my goodness, it could be a person who is experiencing PMDD who may be interested in talking about PMDD with their loved ones.
Oh, sure.
So this was like a twofer in a question about, if I'm either the person who has PMDD, how do I talk to my loved ones about this? Any suggestions?
Absolutely.
Or if I have a person in my world who I think might be dealing with this,
Yep.
how do I do that? And do you have any suggestions? So I toss those two at you.
Yes, absolutely. Well, curiosity and confession time works for either one of those, scenarios. So for partners and loved ones, stay curious without judgment. For people who are suffering, time to confess what some of those thoughts are. And I know that can be vulnerable, and I know that can be really scary, but secrets hold power.
Yes, they do. Yes, they do.
Plans are foiled when we tell on ourselves. PMDD is such a grueling disorder for the women who suffer with it, and they are 7 times more likely to attempt suicide. So it's a serious disorder that needs supportive, non-judgmental environments to heal, and to really, loved ones to have that curiosity while you need that safe space to kind of confess what really that internal and external experience has been for you. And do that with loved ones, do that with providers, so people can best understand how to support you through your individual needs.
That makes so much sense. And what would you say so I would guess you'd maybe offer the same thought to a person who is noticing someone in the world, a loved one in the world who appears like they might be struggling, to note it with absolute compassion. Here's what I'm seeing.
Absolutely. Well, when people are kind of stuck in their symptoms, they can feel like, oh my gosh, I'm not like myself. And a lot of the references that I've heard is, Jekyll and Hyde. And there can be a lot of shame in having this polarized experience of self, and to be vulnerable in that and share that with people.
Right.
So to whomever you're offering that to, whether it's providers, loved ones, friends, someone needs to be on the other end of that to embrace it. And without judgment and without shame, because that is where some of those conversations of how to heal can occur.
Well, and I would imagine, too, if you are the individual with PMDD and you're sharing it with loved ones, there would be that moment where it may not be shocking to the loved ones they're going to go,
Good point.
the mystery is solved.
Oh, sure.
The question marks are answered. Because they're the ones in your space that are seeing and experiencing it with you. And so now there is an answer and maybe some relief to that.
Absolutely.
Because now they can support you.
Yeah, absolutely. And it fights kind of the fault aspect of it. When we know what's going on, the shame can be challenged for the person who's suffering with it, but then also like the blame and fault game of, so-and-so is always upset about the
judgment.
Yeah, and judgment. So-and-so is always upset about the mustard, but there's a reason for that. And it's not, that's not them as a personality, that's them as a symptom, or that's their symptoms showing up.
Yeah,
absolutely.
Rather.
Wow. We're at the end of our show already for today.
Oh my goodness.
So fast.
Thank you, everyone,
you
for
so
listening
much.
this morning.
Yes.
Join us next week as we talk through more mental health focused topics. And in the week ahead, be kind to yourself. Remember that connection fosters wellness, and your voice is one that the world around you needs to hear. Share yourselves, friends.
Some do, some don't, some will, some won't. I wanna feel